Thank you, Sam,
So-
for keeping
so,
in mind of the open meeting
Sam-
law. I appreciate it.
Are you going to time it or you want me to time it?
I can time it because I have the thing. So
Okay, give them and tell them they have, when it's 10 seconds left.
okay.
And on that note, I'll call tonight's meeting to order. The first item is the approval of the minutes from December 30th and January 20th.
Okay.
Motion to approve minutes from last two meetings.
Second.
All in favor? Aye.
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 Okay, now we're going to open this up to public comment. Now, the rules are going to be, you will have 2 minutes to speak. You will be told 10 seconds before your 2 minutes is up. And I'm expecting a lot of comments. If you're going to repeat something that's already been stated, if you could just refrain from doing that, it would expedite the meeting. But we're not holding you back if you feel like you have to say something.
Do-
But I don't know if this can be done right now, but in opening the meeting to public comment, if he is here, I would like the mayor to open it up. And by the way, he will not be restricted as to time. Mayor Reardon, are you here?
He is, so I'm gonna, there we go.
Hey, everyone, can you hear me?
Yes.
All right, great. Well, thanks for picking me first tonight. I don't plan on taking up the 2 minutes. You know, I know you have a lot, probably a lot of public comment to get to, but I just wanted to publicly speak in favor of moving to a mask optional policy, ending the indoor mask mandate immediately. I think, you know, we took great precautions before New Year's, before I took office, and, you know, in response to this COVID Omicron surge, that, you know, I think our numbers are in the spot now that we can move on, kind of get back to a little bit of what it was before, but really just making it a mask optional policy. I mean, there's going to be a good number of people that want to continue to wear masks, and I think they should. And I think, as far as my standing point from some of the city buildings, I think we're all comfortable of moving to a mask optional policy now that we've moved past this surge. And I can tell you, on a school perspective, you know, we have called a special meeting of the school committee tomorrow. And the sense is we're going to support the state's measure of masks becoming mask optional as of February 28th. You know, we've called this meeting on Friday because if we do move in that direction, we want to get that information out before people go away on school vacation. So, you know, I applaud the residents and the people of Newburyport. Our vaccination numbers are very high. We've kind of weathered this latest surge, and, you know, I think it's time to move to mask optional. So I look forward to your vote tonight. Thank you very much.
Thank you, Mr. Mayor.
Thanks. Before we start, I just want to thank the mayor for setting a really nice tone. That was a very friendly, succinct comment. There is a rule that I just want to remind everyone of. If there's any research or data or anything you want the board to vote on or to think about to vote on, that has to be presented before, so that we can read it and analyze the research, how it's written, the methodology, what it really says. And I don't think you need that. So if you could just speak from your heart, you can say whatever you want, but just be aware of that and keep it friendly. We all want to agree. It's a small community. And I'll be timing you. I'll give you a 10-second warning.
Sam, can I say one thing just to frame it a little bit? Because we had, you know, our last meeting, I don't think there was many people that attended the last meeting. And I just think we should I just want to frame that, you know, at our last meeting, you know, we realized that we realized that the school mask mandate had been extended to February 28th, and that it was likely to be allowed to expire, and we knew this meeting would occur before that time. I don't think we ever intended to be out of sync with state recommendations in terms of the school mask mandate. And I think, I agree with the mayor, and I thank him for, his thoughts tonight. But yeah, I mean, I'm in support of supporting the state school mandate. And I think, I don't think that was ever our intention, right? Last meeting to be out of sync with that.
Thank you. Unless any other board member has something to say right now, I think we'll move along to the public comments.
There's one hand raised.
That's the mayor
Oh,
that just spoke. I don't know if anyone else.
we can just vote if you want us to.
We have Jeff Trail.
Hi, can you hear me?
Yes.
Hi, I'm Jeff Trail. I'm a very concerned parent of 2 Newburyport school students. The governor's state of emergency has ended. There's no mask mandate for the state. The State Department of Public Health has ended their mask mandate. DESE has ended their mask mandate. You need to end this mask mandate now in order for Sean Gallagher to end the school mask mandate, because your mask mandate encompasses all indoor spaces. So I wonder what legal authority you would have to impose this mask mandate any longer on our community as unelected officials. For my research, there's no scientific randomized controlled studies that prove that cloth or surgical masks are safe and effective against COVID. Johns Hopkins' recent meta-analysis on COVID restrictions prove that restrictions, including masks, were not effective. The European CDC states that masks are not recommended for kids 12 and under. Sweden never imposed mask mandates, and their infection rates were no different than America. If after 2 years you decide to keep this mask mandate based upon best evidence instead of scientific evidence with randomized controlled studies, then I don't think you're doing your job correctly. 6 feet of social distancing was an arbitrary number of feet that was not based upon scientific evidence, and it ruined people's lives and businesses and robbed kids of their childhood because it forced school and business shutdowns. 6 feet of distancing has since been proven wrong, just like masking has been proven wrong. Masks are far more damaging to kids than COVID itself. Kids need to see each other's faces to learn and socially develop properly. And that was proven in a study last year by Dr. Grunman. If you're not going to end masks now, then tell us when tonight on the record. There's no scientific evidence of when to stop masking, so the time is now. So please don't make up some arbitrary metrics that need to be met. If you do not end the mask mandate, then you're now officially responsible
10
for damage.
seconds.
Medical freedom will always be on the right side of history. Please don't give fake excuses about February school break causing outbreaks. Do what is right.
Thank you.
One comment. This board does have the legal right to set policies. With that, we'll go on to the next comment.
I don't have anyone else with their hand raised at this time. Oh, I have Holly Mazur.
Hey guys, I've got one kid in the Bresnahan school system, and it's really refreshing to hear you say that you're likely going to be following the removal along the guidelines of the state mask mandate, and my kids will be super excited. So looking forward to your vote.
Is there anybody else?
Not at this time.
Well, we may or may not.
The mayor just raised his hand again, so
Okay.
there we go.
Sorry, I'll be real quick. I don't think I said this, but I just wanted to say, I hope we can end the indoor mask mandate immediately. And just know that, the schools are going to vote, and the kids are going to be out of school for a week next week anyway. So, I mean, my sense is that we'll be back at school on February 28th with a mask optional policy. But I do think for the rest of the city, even just to be consistent with surrounding communities, that I think we need to do this immediately. So I just wanted to make that point, that I don't think they need to be together, because we're not going to be in school next week. So if we can do this as soon as possible, I really think we should. Thank you.
Thank you. If there are no other individuals that would like to comment, I'd like to move along with our
I have,
meeting. What was that?
it's Fish. I'm assuming this is the owner of the Newburyport Fish in downtown.
It is. How we doing, guys? Thanks for the minute. I agree with what Sean said. I would.
Sorry, can you say your name and address and all that?
This is Fred, the owner of Newburyport Fish in the tannery.
Thanks. Go ahead.
I'm in favor of exactly what Sean said. I think this needs to be taken, the mask mandate down effective immediately. We tough go at it the past month and a half. The general public was not really informed on it, which left us being the people that have to police it. Everyone's had a pretty tough 2 years. You know, I'm not lumping us into one boat or another, but it's been tough to a lot of grief from folks on the other side of the counter for asking them to wear a mask, or somebody that's not wearing a mask that's upset at another customer that's in there. And it's been an exhausting babysitting task. And so if you guys could end it effective immediately, it would be greatly appreciated. That's just one small business speaking. That's all. I'm not speaking for any others. So thanks for your time.
Thank you.
Thank you.
Is there any other? If not, I want to move on with the agenda. And the next item on the agenda, is the update on the current numbers and trends. Michael?
All right, let me just share my screen. All right, so this is where we are right now. The month-to-date cases for February of 2022, we're at 62 cases. We have had 2 deaths this month, but we didn't have any in January. So that's unfortunate, but they were rollover cases from January that ended up passing away in February. For January 2022, our case total was 601 cases. Pandemic date to cases, so that's all time. So that's March 2020 through today, 2,935 and 58 deaths pandemic to date. Our current percent positivity is 5.09%, and that's 71 positive cases out of 1,396 total tests done.
Thank you. Do we have any? Go ahead.
Oh, sorry, the slide went in advance. There's just a couple more slides. These are just the cases by month of the pandemic. So you can see last month was our highest total month that we've had. February is off to a good start. We're way down at 62. This is just the 3-year COVID case count. So you can see year to date, we're already almost or close to exceeding what we were in the entire year of 2020. And most of those 663 cases were from January. This is just our percent positivity from the pandemic to date, with that spike at the very end being last month's surge of the Omicron variant and our decline through February. And then this is just a closer look in from December 2021 through today of our percent positivity, where we went all the way up to 16.18 and 19%. That was after we implemented the mask mandate, and our decline till today. In terms of school, this is comparing January 2020 school cases to February 2020 school cases. So as you can see, they're already much lower this month, even though we still have 11 days left in the month, but off to a good start. Our vaccination rates, I won't go by age, but just the total percentages. 82% Newburyport residents are fully vaccinated. 11% are partially vaccinated. So for Newburyport residents with at least 1 dose, that's 93%. And then 42% have boosters. This is just data that was actually sent in by a resident as part of their public comment of the Deer Island treatment plan. I just pulled the updated one. This is from the Massachusetts Water Resource Authority, showing the decrease in that. is what I have for numbers. In terms of Anna Jakes, we do have Dr. Glenn Focht, the Chief Medical Officer, on if you guys have any questions. But they are down in single digits now for both COVID patients and number of employees out with COVID-19. They have reinstated inpatient elective surgery as of last week and are back to normal state of operations. They're continuing to require masking for patients, staff, and visitors in the building and restricting visitors to one person per day on select units. They're requiring staff to receive booster shots, and that will be considered fully vaccinated. And if you guys have any questions, like I said, Dr. Focht is on the call as well.
Thanks, Michael. That's really helpful.
Any questions on any of the other facts and numbers that Michael presented?
I just want to ask Michael, I think we're both on the same webinar on wastewater surveillance. And did you get any information on Newburyport being able to do more of that from wherever you were checking, or should I wait on that? Or
I still have to talk to Tony Finari at the DPW. I haven't had a chance to talk with him yet. I'll definitely let you know.
that's exciting. I'll wait.
Okay, moving along, now is the item that we've all been waiting for. The indoor mask mandate.
Okay. I just want to do some of the same framing that Rob did. Because this goes back a little bit farther if we're talking about all masking. So number one, we haven't had a 2-year mask mandate. This is not the school board. No one should get confused. There was a mandate for 3 municipal buildings starting in August. Correct me if I'm wrong, the library, City Hall, and the senior center.
That's
No other facility. And that was upon the request of the mayor at the time, and concern with increased, at the time it was Delta. There was numbers starting to go up and modeling showing that there was going to be increase in October that was going to be substantial, which there was. We voted for that. I think we did a great job because we were well prepared. I think other factors were there was not a lot of community immunity at all. People were still just barely getting their second shots. The vulnerable people were thought to have immunity waning in October. Very few people had boosters. Rapid testing was not a thing. Masks were still very expensive. So that was a different time, and it's important to set the context for that. And then we had no other mask mandate until, as Rob said, in December, we met, having been in the midst of the surge that we had predicted. And then upon, again, the request, we implemented the mask mandate to go for a month and to have that checked again in a month. So for 4 weeks. Within that month, we had record surge, record numbers of, which were probably an underestimate of the numbers that were recorded. And that was Delta, 50% Delta, 50% Omicron. Anna Jakes had reported a day of maximum capacity. And by the time of our second meeting, or our meeting in January, the numbers were coming down, but not when you're in a skyscraper and you go down a few floors, you're still up pretty high. So we had voted to extend till December, and there was a request to, extend till February, and there was a request to sync it with the mask mandate in the schools to have just one date. That was what Rob was referring to. So at this point, I just want to say I wanted to avoid this, but I know people record this meeting and sort of transcribe it on the internet. So I want to address any misinformation that was presented. One, so we have plenty of information on masks, and I'll talk about that a little bit later, but we do have a lot of substantial information on masking working, and the basics of it is not to go into too much science, but if you cover the holes through which the virus comes out and through which the virus goes in, you're basically reducing transmission, even if it's a certain percentage, which depending on what kind of low quality cloth mask you're wearing, from a public health perspective, that percentage is a lesser amount of people that are going to be transmitting the virus, lesser amount of people that are going to be surging and then filling our hospitals. And the goals with all of these interventions were to at least bring our transmission rates at a rate in which our medical establishment could absorb. And masking was early on our only intervention. When we didn't have vaccines, we didn't have any sort of other intervention. And very much so were implemented in areas that already saw surges. So already had a problem and then had to reduce that problem because there was going to be no room for more people to be absorbed into the hospital system. And then, so within that context, we're at a different point now. We have vaccines, we have rapid testing, we have high quality respirator masks that the government is giving out free. And I talked to Michael about setting up a way in which people can, or we can help people access those if they don't know already. And the certain other statements that were made that are also false about there's no, the Hopkins research on masking not being effective, that is not true. That was a mask study that was done in Denmark in a highly sterile environment where very strong restrictions were already in place, and it was basically comparing a control group that was compared to a mask group, and the control group was socially distanced, in very strict government restrictions, very much just one step out of lockdown, and also not really a control group, but just a study where these people were followed over time, and the researchers themselves said the study was inconclusive. So that is only a study you would bring up if you were talking about doing other restrictions instead of masking, not doing masking versus nothing. So it's a little bit misleading to bring that up. And then I think that's all I would necessarily talk about, except for my stance, which is based on the research on the respirator masks. I can say from my perspective, I'm an industry that we're masked in the oral health workforce and our patients are not, and we're inches from their face and there's aerosols and spit. And we as a whole have not gotten any more sick than the rest of the population. And early on, I don't know if anyone remembers, but in 2020, when this first came out, there were articles in the New York Times about who's most at risk, and hygienists and dentists were at the top, and people were freaking out and didn't want to go to work. And we were the first industry to shut down. We shut down before anybody else shut down. It turned out that we were actually relatively safe. We have not gotten sick in the first wave more than the rest of the population. And I was holding my breath for Omicron, but we still haven't gotten any significant spike in transmission with Omicron. And it sounds almost easier to digest now, but we were dealing with a virus that was very small, just a fraction of the flu virus. Our control measures were not tested on something that small, but a lot of measures were taken into account that other offices might also have, which is HEPA filters, ventilation, other sort of where patients are masked in between work. But as a whole, there is no sort of universal practice that all dental offices over the course of the whole country can be guaranteed to take. So I say that saying that some offices may just use surgical mask level 3, some might have KN95s, N95s, and still across the board throughout the country, which there has been no significant increase of transmission in the dental workforce. So what I'm talking about essentially is one-way masking, which can translate into this as elective masking. So if people are vulnerable and they don't want to, if they're fearing getting infected in any facility, if they're going into the supermarket or anywhere they need to go, they can feel confident wearing the KN95 and the N95s that now are free that you can order, and we can help you do that. So in light of all of that, it seems like it's appropriate now to add, to instead of calling this an end of mask mandates, but to that we are transitioning, because messaging is really important, headlines and whatever, that we are transitioning to advocating for elective one-way masking using substantial respirator masks. And that is all I have to say.
Yeah, thanks, Sam. Robin, you mind if I just say a couple
No,
quick
go ahead.
things?
Go ahead.
Yeah, I just wanted to bring up the last meeting. I think because, as Sam said, the indoor mask requirement in Newburyport, I think it's 51 days. It's been in effect. And I think on December 28th of 2021, I think that was a reasonable thing to do. When we met in January, things hadn't changed enough to rescind it in January. It would have, the reasons we put it in place in December were not resolved in January. So it wouldn't really have made any sense, and it seemed reasonable to keep it going. And I think that, it was always our intention to sort of reevaluate this. The board, I think maybe some of the frustration and the emails we received is just people not, being aware of the board and when we meet and, how we go through these processes. And, I hope this is not most people's last Board of Health meeting. I think, one thing I was thinking of, we got an email about how masks increase pollution. And it got me to thinking, like, all those meetings before COVID that we had where we were discussing, the sanitation policy for the city, right? Like, probably a lot of people don't know that, because sanitation is part of public health, the board, the sanitation policy in the city falls under the board. And we had a lot of conversations about, I think really important conversations about, how do we have equitable curbside pickup for everyone in Newburyport? How does that get paid for? How do we, how do we get people to be stakeholders in the amount of trash they produce? And, these are really important things for our city, and mostly no one attends any of those meetings. And so, I'm in support of, I think it's time to have kids take off their masks at school. I'm in support of a mask optional policy. And I think if people, came to more of these meetings, knew who we were, heard our discussions, and understood, like, hey, we can't talk to each other in between meetings. That's a violation of the open meeting law. That's why we can't, make those decisions when we're not in open session, right? So, I don't mean to drag this out, but I hope that, this sort of shines some light on, hey, the Board of Health is an important part of our city government, and participation is valuable, and I think it helps us all.
And just to add to that, this also was true before we went virtual. When we had meetings face to face, we were lucky if one other individual showed up in every 6 meetings. So it's not something that seems to be, shall I say, valued by the general public. And like Rob says, we cover a lot of ground. And the whole idea is to keep the health of the citizens of this city foremost. Now, getting off the soapbox, I think we should consider right now removing the mandate. But as Sam was saying, removing the mandate doesn't mean that an individual who chooses to wear a mask can continue wearing a mask. And I am in favor of this getting rid of the mandate effective tomorrow as opposed to the 28th. And I'd open this up for a motion and any other comments by the board members.
I just have one question that I don't want to, because we can't talk about this until we have the meeting. The email the mayor forwarded to us about the senior center, there were several questions as to how to go forward there. I'm just going to pull it up just to make sure I have it correctly. And there was one question about what if masks were to, if mask mandates were to be lifted, could they continue to have one? And then they also had questions about, maybe we can discuss that later, but what to do for return to work policy if people were COVID positive. But as it relates to masking, I would say also there, if they have access to respirator masks, the one-way masking, there's still a lot of research on, and a reduction of 86% transmission just on a respirator mask. I don't know, however, if all of their patrons have access to respirator masks, but I just want to make a note of that because it's senior center is a lot like a health facility, and so for like my office or where we work, this doesn't really have a relevance. We're still going to be under a mask mandate as healthcare facilities, just like transportation, public transportation, other facilities will still have that. But it's sort of like a special case. I just don't feel comfortable not talking about it. I just want to know what the other board members.
No, I think that's a great point, Sam. I think, the current, the state recommendations that came out, I think today, are that if you are a vulnerable person or you are someone who is concerned about your, contact with a vulnerable person, you live with someone like that, or you're around someone like that, you should continue to mask. There's still a lot of COVID out there. And so I think when you walk into, if you're an elderly person or an at-risk person, and you go into the senior center, you go out in public, you should put on a high quality mask. And I think anyone who is not a vulnerable person who walks into the senior center should also, just out of kind of common caring to the people that utilize that facility, you should really put a mask on, because you are then becoming someone who is in contact with someone who is at very high risk of COVID. So, I think, I think what we're saying is masks can be optional, but they're not, they're still necessary in a lot of situations and for a lot of people. And I think actually that's something we should talk about as a city. I think, I know that the city, as well as where I work, we've taken advantage of getting the vaccine early. We took advantage of getting testing kits, home testing kits. One thing that we haven't taken advantage at my work, and I don't know if the city has, is getting high quality masks from HRSA. I think that's an option, right? And because sometimes people who are most at risk of a disease are the people that have the least amount of resources or ability to get those things, right? So, elderly people often, they're on a limited budget. These masks are expensive. And so, I think that's something we should look at as a community, making sure that people who are at risk can get high quality masks. And, people around them, please use common sense and mask up.
Especially since some of it can be ordered online, help ordering online, or is there a way to donate to the senior center N95 masks, or even surgical level 3 masks, or is that not something we can do because we have to be equitable to the full community?
I don't see why individuals can't donate to wherever they want to. And if the senior center is a priority for some individuals, then so be it. I don't think we have to worry about discriminating against one organization or another.
Okay.
You're making a donation, you're making a donation to whomever or whatever you want.
Okay. All right. Just
Oh, and by the way, if you are donating masks, they should be sealed, new packaged only.
right. I'll follow up with that. And then just to maybe round that email off, when in the email they ask about the return to work, and it goes a little bit with messaging, because they're talking about should they just come back to work after 5 days? We're a vulnerable population. It's still 5 days asymptomatic, which I think is very confusing for everyone because they don't understand, is it 10 days or 5 days? It's easier, I think, if we just advocate for the return to work policy to be with a test. The 5 days is supposed to be with the test, 10 days can be too, but I've tested anyone coming back to work that was positive, and 5 days are not necessarily negative on an rapid test. They're still producing antigen and it's still infectious. So,
And I can
go ahead.
For city employees, so that covers the senior center as well, we still have the policy in place that they do test to return to work.
Perfect. So that takes care of that part.
And
Okay.
I've told Paula,
Sorry.
I was just gonna say, I've told Paula we can extend that to the volunteers at their front desk as well that work in there.
And that's another area where masks are still necessary, right? So if the decision is made for you to go back to work on day 6 or go back to school on day 6, technically you're supposed to be wearing a mask until day 10.
Good point.
Hey, Sam, there's a couple questions in the chat.
I can't see it.
Someone named Bob is asking about, he's a little concerned about ending a mask mandate before children under 5 are able to be vaccinated. Do you want to say anything about that, or?
I have a question with that. So again, with that, if I was a parent, which I'm not, so I have to qualify a statement, I would definitely mask my children that have not been exposed to or have not been vaccinated, especially if they're not been vaccinated. I don't know how the fit is for a respirator mask on a 5-year-old or younger. That is not something I encountered. That was actually a question I had coming into this that I forgot about. Can there be access to, because it's not the ones that the government's handing out. N95s are often fit check. Is there small N95 or respirator masks available for young kids? And with that, I would think that would be my recommendation.
The other thing I would say, Bob, is that, like, for example, with the flu, we can't vaccinate babies under the age of 6 months. And the flu can be risky to babies in that age group. So what we make sure to tell parents is, make sure you get your flu shot, make sure, the people around the baby have their flu shot. And I would say the same thing about the COVID shot, making sure that, the people, you create a sort of a blanket of immunity around the baby, making sure everyone's vaccinated around the baby. I think, the risk to kids under 5 of COVID, it's not zero, but it's lower. And I think that as we see numbers start to decrease in the community, I expect we're going to keep seeing these numbers go lower and lower. There's you need a host that can get infected. You need the virus to be circulating, right? You need community transmission. So masks, vaccines, and community transmission all sort of create this risk. And if everyone is vaccinated and community transmission is low, the risk to those younger kids is going to be much lower. So, and I think that's kind of the irony of this. One of the ironies of, I think we're all very frustrated, but I think, the next few weeks to months should be really good for COVID, knock on wood, barring some, sort of crazy new variant or something, right?
Great, knock on wood. That said, I don't know how well children of that age are wearing masks anyway. So those other mitigations are probably really important. We do have a program that if you do want to help build community immunity, vaccinations are the best way. And Hopkins has a course you can take online to become a vaccine ambassador, and we have a vaccine ambassador program that we're starting. So we can set you up with a link, and we really need to keep that our vaccination rates high. If you're not boosted, booster. That really makes a difference. There's a myth that everyone's going to get Omicron and then we're all going to be immune from that, and there's no evidence of that at all. We don't know what kind of vaccine, what kind of immunity you're getting and how long from Omicron, but the vaccinations have proven to keep hospital rates low, severe infections low, and hopefully soon there'll be the vaccines that are approved for kids under 5.
Yeah, and Sam, you've always been a big fan of rapid testing, and so we're gonna have like tons of available test kits going forward. The supply is going to keep increasing, the demand is going to decrease. So use those if you want to have, if you have a young baby and you want to test someone before they come over, that's totally reasonable. Or if you have someone who's at risk, you should do some testing around that person to make sure, and continuing to stay home when you feel sick. If you got a fever, stay home. There's a lot of things that can still be done, and we should still continue to use common sense and take caution. I think we throw around the word endemic. That doesn't mean harmless, right? There's a lot of things like HIV is endemic, right? But it's not harmless. So we should still a lifting a mask requirement and not having masks in schools doesn't mean we shouldn't still take precautions, especially around, at-risk people.
Yeah, I don't want this to come across that the headline be mask mandate is lifted and then the sentiment being like, this is over, or vaccines are there, this is over. And then this idea of everyone against these measures have been calling it endemic for over a year now. And I think that term is used incorrectly. It can be syndemic. There's other, nuanced epidemiology terms that you can use. This can be a wave that happens every year. But we do have all these other measures we can use to help keep it under control. And then, hopefully that advances. Hopefully there's more vaccines for kids. And as you said, the testing is really, really helpful if it's done correctly. It's unfortunate that we don't have it as freely available as other countries, but that's been a big help everywhere else. There was one other thing we wanted to say about that. No, we covered the vaccine ambassador program. Michael, is that somewhere they can link to on our website?
Yeah, I'm pretty sure. Let me just pull it up. I'm like 95% sure it's on the COVID-19 page of the website.
Okay.
On the city website, under the COVID-19 page for vaccines. I put the link there.
Thank you.
And just while I'm talking, Molly Attenborough just came over to my office and had a really good point. These eye health kits, that's upside down. The eye health kits that we handed out, their expiration date is June of 2022. So they do have a pretty long shelf life. And, I don't think they'll get extended like the Buy Next Now ones did, but I just wanted to point that out as well.
Thank you.
We ready to vote?
Is there another chat message, or was that it?
I think that was. I think that was it.
There was one that I just want to, because it was, the mayor answered it in the chat, but I just want to make it clear that if the mask mandate is lifted after you guys vote, the school's mandate is still in effect through the 28th per the state. So they still need to wear masks tomorrow to school, and then they're on break. So it's a non-issue, but this one doesn't affect that one because that one's a state mandate not put forward by you guys.
Okay.
So we should take action right now on the mask mandate.
How do we phrase it? I'd rather it say something such as motion to end mask mandate effective immediately in lieu of a strong recommendation to electively wear respirator masks for individuals who are still or not still for on a voluntary basis. Motion to transition mask mandate to voluntary advisory. Ram, do you have any suggestions?
Yeah, I mean, I think, motion to end indoor public mask mandate with and replace it with mask advisory or something like that. Indoor public mask advisory.
I second.
All in favor?
Aye.
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 Okay.
So the motion is passed. And as of tomorrow, there will no longer be a mask mandate, other than those who choose to do so on a voluntary basis.
Okay. There's another question in the chat. I mean, are we ready to move on? I mean, we're gonna.
Well, we can talk about it.
Yeah.
Yeah, we can still keep talking, right?
Yeah. There's 3 messages now. Okay.
Just a question about what we're doing to roll out, to encourage or roll out boosters. I mean, I think you kind of touched on that. Sam, but it's Dr. Ibrahim is asking about what the city's doing for that.
Sorry, I can't see the chat.
What are we doing to push booster rates above 50% or so we have now in the community? What do we can we do anything about that, Michael, or anybody? Or
Yeah, I can
Yeah.
speak to it a little bit. On the website, we do post vaccine updates on where you can get appointments. Right now, we have one up there there's a clinic on March 2nd from 3 p.m. to 8 p.m. at the middle school. I'm not 100% sure what the Lower Merrimack Valley Regional Collaborative is doing in terms of clinics. I know they had one on the 14th. I don't know what their plan is for long-term. I know Pam actually was just looking into the other day what the minimum requirements for us to purchase vaccines are. The problem with that is the minimum is 300 doses. And we don't know that at this time we have the capacity or the need in the community. We haven't been getting calls like we were before to go through those 300 doses. The mayor's chief of staff, Andrew, just raised his hand. He might have more. So if it's okay with you, I can allow him to talk.
Sure.
All right. Andrew?
Hi, can you hear me?
Yes.
Excellent. No, thanks for allowing me to speak. I just want to say that this is a priority from the mayor's office. We have been posting about it on our social media feeds and trying to use whatever platforms we have to get this out there. The Board of Health's done a great job to make some appointments available. There's that upcoming clinic at the Knox School as well. So that's great to see on I believe, March 3rd. If it's of interest, we can also try to work with the state to get a mobile clinic in, perhaps to a place like the Council on Aging, so we can get some more appointments there without having to stick to that 300 minimum that Michael was talking about. And that was a challenge in Billerica where I worked previously, was we just didn't have that kind of demand, but we did need a significant number of vaccines. So perhaps we could explore that with the Board of Health if there's interest there. But otherwise, we'll just do our best to try to keep the announcements coming from our social media feeds and from our town website and everything else we can do to get that out there.
Thank you. Okay. As we move along, Michael, do we have any department updates?
We've had a couple of good things on the Thirsty Whale. They officially reopened, I believe, last weekend. After 2 years, they closed because of the pandemic. So now they are finally up and running and they passed all their inspections. New Kitchen is also a new restaurant. It's on Pleasant Street down. It used to be Szechuan Taste and then I think Thai Lily. They, as of today, have passed all of their inspections. I think they're hoping to open Monday or early next week. So those are 2 restaurants opening and don't think there's anything else. The only other thing would be scheduling of the health director interview that we need to nail down a time for.
Okay. As we batted around via email, I'm pretty much open to whatever anybody else wants to, what is convenient for anybody else. It's one of the perks of being retired.
Sorry, are we talking about the interview schedule?
I had a question. Are we interviewing at the same time together, like a 3, or is it we each individually interview?
We, the 3 of us, interview at the same time.
Okay.
Wait, can I ask a question about that? So if we interviewed, I'm not saying that we shouldn't do that, but if we were to interview separately, would that still be required to be done in a public forum?
Yeah. So
Okay,
because it's the finalist interviews, that's where the issue lies with the open meeting law.
and then are we gonna like discuss the candidates? And we're gonna do that publicly as well.
Well,
Okay.
in the past, which in the circumstances was totally different, obviously, we would interview the finalists individually, and then the three of us would discuss the candidates, the pros and the cons, and then make a selection at that time.
At the same meeting, we would discuss?
Yes, yes. That's the way we've done it in the past.
Okay.
I do have the mayor has his hand raised, so I don't know if he can maybe shed more light on this. There we go.
I don't think I can shed more light, but I think I'm part of that process, right? As far as right. Okay,
Yes.
that's what I thought.
Yes.
And I know, this is something similar that we went through with the superintendents. I mean, we had our finalists when I was on the school committee, and they each came in on a separate night. One would step out because it wasn't in a virtual setting, but we interviewed one, and then one stepped out, and then we interviewed the other one, and then we would deliberate. And that night we made the decision right there. I don't know if that necessarily is the case, but we'll do the interviews, and then I think you'll probably make your recommendation, and then I'll probably either decide right there or think on it and then announce it after the fact. Is that okay? Does that work, Michael?
Just a point of clarification. You don't make the appointment. The board members make the appointment.
Okay.
That's a state law.
Okay. I was under the impression that you would make a recommendation, but the end decision would still be mine.
No. State law gives us the power to do that.
Okay. I'm definitely gonna double check that. I'll check with Rich Jones. I think he's still here, but that's fine. I still would love to set this up as soon as possible.
So would we.
Okay.
Okay,
So are we saying, so do we want to schedule something? I mean, should we?
When are you available?
When am I available?
Yeah.
Yeah, Thursdays is, like I said, is bad for me. It's like I
Okay.
have to leave to get to do this meeting early, and so I can't gobble up another Thursday. Pretty much any other evening would be fine.
Friday?
I can, yeah, I could do a Friday. Like what time? Like a 5 o'clock kind of a thing, or 6
5 o'clock.
o'clock?
Whatever you want.
I can do a Friday at I can probably do a Friday at like 5 o'clock or 5:30 maybe, just to give me a little bit of breathing room.
You sure? You don't want to say 6? I can do whatever.
No.
We'll make sure you can do it.
I would prefer the earlier the better
Okay.
Okay.
for me.
Okay. I'm fine with 5:30 on Fridays. Is that tomorrow then? Or are we gonna set that up next Friday?
Yeah, we'll have
I don't
to-
think we can have the candidates in by tomorrow. Just being fair to them.
Okay.
And do you want to do
Try
this?
both of them in one evening, back to back kind of thing? Is that what we're saying?
Yes.
And do you want to do it via Zoom or in person? Would be the other question.
I think it would be easier to do it in person, because asking a person to leave doesn't mean they're going to not listen to what our deliberations are.
Well, we can make sure about that. I mean, we can, I mean, I'm not going to be in town next week. I won't be in Newburyport next Friday, if that's what we're thinking.
Right. I don't know if I was saying Friday as a non-Zoom available time. Maybe we could.
I think it's all going to be Zoom for me, frankly, even if it was like, I mean, unless it was later on a Monday or a Tuesday or a Wednesday, maybe, but I mean, I've
there a
done a
way to-
lot of interviews via Zoom and, you
Yeah.
know, it works okay.
Okay.
And what does the mayor think about that? Is that reasonable?
Either way, is it like an open meeting interview?
Mayor's gone.
How does the other person not? He's checking to see whether or not he's appointing the director.
Oh, yeah. Uh,
Is it even regardless in an
Oh.
open
There
meeting?
you go, Mayor.
you would just send two Zooms, one Zoom to the first candidate from 5:30 to 6, and then the second Zoom would be to the other candidate from 6 to 6:30. So, and it'll be different meeting and password, you know, whatever.
It has to be done in the open, which is,
So then how do they not in?
Oh, well,
mean,
then they're gonna hear anyways, right?
So even if it's in person, aren't they entitled to sit in at the other person's meeting? So,
I don't know
Okay.
that, I can just tell you on when we did that for the superintendent search and hire, you know, they stepped out. So, I mean, you know, I don't see why they'd want to sit in and watch the other person get interviewed, but again, we were in person, so I don't know exactly what you guys are thinking.
Well,
can you
what-
do two Zooms? Can you do two Zooms that are open meeting? Back to back?
Yeah.
If it's open, they could get, you know, go on to one or the other. If they really wanted to, I don't think they're gonna probably want to do that, right? Maybe they would, but
I mean, they're entitled to, then they can, but it shouldn't be, at least if there's two Zooms, it's not like they're stuck there like watching it.
well, and also the deliberation is in an open forum, right? It's public, right?
Is it? Okay.
I think that's what we said at the beginning of the conversation, right?
yeah.
It had to be. So, you know,
Okay.
No, the interview process, I think, would include HR and the mayor. But the actual vote would just be the three of us.
And the vote is open? Okay.
Yeah.
I mean, I think, you know, obviously this needs to be very collaborative, right? Like, you know, this is a person that's going to be working in City Hall
Right.
and the mayor works there too, you know.
Well, believe me,
So,
if I don't, like I said, I was under the impression that the final say would be mine. So once I find out that that's not the case, then I'm definitely gonna be making my choice pretty public. So.
The
I mean,
mayor has never made the appointment for the director. It's always been the board.
No, I'm not doubting you, Dr. Blair. I'm just telling you what I was told. So, I mean,
you know, it seems to me like there's kind of two very different candidates. One is a person that has a lot of like health department experience. And one is a physician who was on the Board of Health, I guess, in Newburyport. So, you know, that's two very different candidates in my mind that bring, you know, probably different strengths and weaknesses, right? You know, I don't know a lot about how to make sure a kitchen is up to code, right? But, you know, I know some things about other things, right? So, and I would think the health department, you know, the person with all the health department experience would probably have more experience in that way, whereas you know, a physician would bring a whole other sort of, you know, level of knowledge base, and maybe, you know, maybe could add different things to what happens at the health department actually. So
I have more questions about how we deliberate this. Before the interview process, are we allowed to talk about this without it being an open meeting? Or is it?
we
No?
can't talk to each other about anything.
Correct. But I thought, well, how did we schedule? There was one.
Scheduling and agenda creation does not fall under the open meeting law.
Okay. So,
Yeah.
okay. So how do we organize this interview? Like, do we set the questions? You know what I'm saying? Like, how do we organize it? Is that open meeting? Or can we just like set an agenda of what we're going to talk about outside of open meeting, like what the questions would be? And
I know Donna from HR was doing some research into what other towns had done. I'll connect with her tomorrow tomorrow, well, we're not here Monday, but tomorrow or Tuesday, and see what she found. If not, if she hasn't found anything, I'll call around and see what their processes were.
Hey, Michael,
Yeah.
can I ask you a couple questions about like your sort of background and knowledge base? Would that be okay?
Yeah.
Like, so like, you know, seems to me like you have a lot of knowledge about sort of, you know, the things that like we would always lean on Frank about would be like, yeah, things like the kitchens or like, you know, the food carts at the, you know, at the festivals and, you know, like sort of the, you know, the
Inspection.
codes and things like that. I mean, are you, where do you lie in that sort of, you know,
Can you ask
know
those
what
questions?
what's that?
Can he ask those questions, you mean?
Well, I'm just thinking, you know, if you were to hire, like, say you hired a physician that really didn't have that knowledge base, is that, you know, then you would want to know that Michael could complement that person, I think, right?
Well,
Yeah, and I
Is
don't.
that a fair, is this a fair discussion to have? Or, I mean, I won't, I'll stop if it's not, you know.
I mean, I don't think I would I don't think I would hire someone that didn't have certain qualifications and then like have Michael pick up the slack. Like, I wouldn't frame it that way.
I mean, it's a big field, man, you know, like it's everything from
Yeah.
infectious disease to trash, right? So,
Right.
you know, just a
Which
not.
is, yeah. Is the mayor still on?
I am.
What is you sound like you have like a preference. What is your, without like naming any, but what is your preference on what a director would look like?
Well, I'll be honest. I didn't sit in on the screenings, but I did have, you know, a few people in my office partake in those. My feeling is I think we need someone who can come in and hit the ground running. I would really favor someone more who has a health department background. Because, you know, I think Michael's done a wonderful job keeping this ship afloat, as I said in my email to you guys earlier today. But, you know, I think the other candidate, even though she has been on the Board of Health, I understand she doesn't have all the certifications that she would need. So she'd have to go through that process to get that. That doesn't mean, you know, I don't know. I haven't seen her, so I don't know if she'd be a good fit or not. But in my head, you know, as you know, the one here in the corner office, you know, I want the most qualified person that can jump into that role and run with it.
Got it. Thank you. So I kind of lean towards that mindset. So I kind of want to at least establish like how we're going to suss out the qualifications we are looking for. And I mean, Michael, if you could help with that, but it sounds like we're already writing that list down. And Robin, how is the interview normally conducted? Do you just run it as chair and we listen, or?
No. With my dealings with it in the past, if we didn't have any preset questions, board members would, for lack of a better term, ad lib. And if somebody got the ball rolling on a certain subject and we wanted to get more information on that, so it would be. And then like whatever topic the three of us would like to present to the candidate, that's what we would do.
Okay.
And the other individuals, human services, the mayor, they would not be involved in the decision making. They could pose questions, but the final decision making would be the three of us.
And another last question I have is, how did these two get selected? Since we weren't part of that process, how does it narrow down to, how did these two become the final two? What was that?
I believe it was the was Donna from the Human Research Resources. And I know at one point, she said to me they had 4 candidates, which at the time did not include the physician. And and those 4 candidates, I'm not sure how many applications came in, but if there was, say, 6, they went through the application, see if they met the qualifications that they were looking for, and present those people. Now, whether or not if the 4 went to 2 because the candidate withdrew or was deemed not fully qualified, that I don't have an answer for.
This is Andrew Levine, the Mayor's Chief of Staff. I was in on the process. It would be helpful for me to add anything on that.
Thank you.
Please.
So there were 5 candidates who were interviewed. I unfortunately can't speak to how many ended up applying for the position, but I believe there were more than 5. But we did interview 5 who met a certain level of qualifications, and we decided to present to you 2 top candidates, thinking that both of them, among the 2 of them, you would have 2 good candidates to choose from that we were particularly interested in. I would say that of the 5 we talked to, if you needed to see an additional, there's probably at least 1 other who could be considered qualified, perhaps 2, but these 2 rose to the top.
Well, I'm comfortable with staying with these 2.
Oh, yeah. I mean, I'm not familiar enough to say otherwise. They're just so different that's why I was confused as to, like, are we being, did they come from different rounds of qualification? Are they purposely different, or, you know, how this gets whittled down? But okay.
It wasn't to present you with 2 different ways of taking the position. That wasn't our intention. It was mostly just because these were the 2 that felt like the best fit for the position because of the different strengths that they offered. While still there are potentially trade-offs to make. I can offer my own opinion about one having fewer trade-offs, but I don't think you need to hear from me on that.
Is it reasonable to say that at this point in the process that they're both candidates that the mayor would be comfortable with, do we think, or?
Like I said, I wouldn't answer that because I didn't sit in on those interviews. So I just kind of told you what I'm looking for in the next health director. But again, I didn't interview either woman. So
Gotcha.
And then
Thank you.
you said that one of them was on the Board of Health in Newburyport prior?
Yes, I
And
served with her.
okay, that's what I was
Quite a
gonna ask.
long time, actually, right, Robin?
Yes.
What
She
were
was
those?
she was on before I came on the board.
Okay. What were the years? Well, when was the last term served?
I think it was like 07 to 15, but I'd have to double check the CV to know for sure.
Okay.
It was like a significant amount of time.
Okay. I mean, that's fine. All my questions are going to be probably, as you know, about misinformation, etc. I'm sure, because I find that to be the number one problem rearing its head. And then you all can probably cover everything else. And if we need Michael, can you feed us information on how, like, what a good hit the ground running type skill set is?
Yeah, kind of hard to answer. But to your point earlier, Rob, I don't have those, and like you were talking about leaning on Frank for the food things. I don't have that food background. I don't have those certifications.
Okay.
Fairly new to municipal health. I mean, I was in hospitals when I was doing my schooling. I worked in COVID testing before that. I've only been in a municipality since the end of September. Kind of learning as I go. When I get a housing complaint, reading the code and addressing the complaint as I go, if that's helpful to answer your question.
What about, thank you. I mean, now as you're talking, I'm sort of thinking like, so I get, is the, I mean, we have the public health nurse, we have the animal control officer, we have inspectors. I
Who do we
mean,
have as inspectors?
don't we have,
Inspectors.
We have
We
one
still-
inspector, Elaine Wozni. We lost one, and I've been trying to fill that. But I reached out and I interviewed with one other person who was possibly interested, and she declined just the other day, I think yesterday or the day before. So we are down to one inspector at this time.
we have one public health nurse, so do we hire a second nurse during the pandemic, or was that
School
temporary
nurse.
or something?
We had we had a new school nurse, but I don't
Okay.
think. a
Yeah, we
second-
just have Pam as the public health nurse.
I mean,
And everyone's super busy, like everyone cannot take any more on their plate. And I just remember Frank being just 6-day, 7-day work weeks. It's a big job. It's a
Does-
huge.
and this is just a question, does it make any sense to have any of those people involved in this process at all, or?
Which people you're referring to?
You know, the people that do the work of the health department, I guess, or
No.
some of them, or no?
No, because they would be involved with picking their boss.
Mhm. Okay.
Yeah, I just was wondering.
I don't think it's a good idea.
Yeah, okay. Okay,
If we don't like either, can we go back to the pool? Just worst case scenario,
Why not?
you know, it might be helpful to have a third candidate just because these two are so, I mean, just to like get a feel of what people bring to the table. I
The review
would,
committee, oh, sorry.
I would feel more comfortable with that just because they're so different, but go ahead, what were you gonna say?
The review committee has a third person in mind, should you want that, in case it was requested. We thought that the top two, rose to that top tier, but there is a third who we think you can certainly interview if that's of interest.
What does everyone else think?
I'm comfortable with the two
Okay,
because this is my personal opinion, okay? Because if the third person was as high up the ladder as these two are, then I believe that Andrew and Donna would say, we have 3 candidates for you to interview, rather than reaching back into the well and bringing up a third candidate. Now, if we don't like either of these 2 candidates that we interview, then we can go to this other individual. But that's just my opinion.
okay, are we looking at next week, do we think? Is that what we're trying to say?
The sooner the better.
well. Next week? I missed whatever was said.
He said the sooner the better.
Oh, okay. So Monday's a holiday, which I could do, but then Friday at 5:30, the 25th.
I'm on vacation the 25th. Oh, no, excuse me. That's March 25th. Yeah, this was wishful thinking.
But
Okay.
I didn't hear what he said.
He thought he was on vacation, but he wasn't. So February 25th is still on at 5:30, if we can get everyone there.
Oh. It works for me.
Okay. Okay. And then, so it gets decided that day, basically.
I would think so.
Okay. All right, I'm gonna go
And
with
we do
your
have-
experience that Robin, if you think 2 people's is enough, then we'll just do that.
We do have Donna Drellick from HR on. I know she was off, but now she's back on. If you
Hi, Donna.
get questions about,
What-
I know.
Well, what's the ETA on, like, I mean, when do we want to, I guess the mayor's going to look into clarifying the process. Is that, will we hear about that, or is that?
I mean, I'll speak up. I mean, I'll check on this first thing. I mean, I'm, Dr. Blair should know. So, I mean, I'm not doubting what he's saying. I just want to clarify, just because it wasn't what I was told. So I can do that first thing tomorrow. I was going to ask Rich Jones, but he had already left from the budget and finance meeting. So,
I mean, I wonder, Robin, like, should we, I'm just wondering if it would be, like, we could meet, we can't discuss this at all. We couldn't even discuss this with the mayor individually. That would have to be open meeting as well, or, I would kind of like to make sure we're all on the same page here, I guess, is what I'm saying. No, is that, are we, maybe we are.
as
Without
long as you
saying
don't
who
talk
it
to each
is,
other, I don't know why it'd be a violation of open meeting, right?
I kind of think we should interview the candidates and then, maybe talk to the mayor about it each, and then we meet together and have a vote. Would that be a reasonable process here? That sort of seems like,
That's how I thought it worked.
wait, what was this process that we meet?
so we
together?
would interview the candidates next Friday.
Mhm.
And then we would maybe each consult with the mayor and make sure we're, see what, tell each other what we think, and then we take a vote.
Is consulting with the mayor individually open meeting?
I don't know. I don't know if that's the process. That's what I was just sort of throwing out there as a potential process,
Well,
I mean, okay.
that hasn't been done in the past.
So you're saying we're gonna meet next Friday, interview them, and then take a vote?
Yeah,
Okay,
Donna,
that's what he said.
that seems kind of intense to me.
You know where I stand on issues.
this.
Michael, can you hear me?
Yes.
Okay. I thought it was the board would make a recommendation to the mayor, and then you make a decision in conjunction with one another. Am I wrong?
Well, like I brought up to the mayor, I remember once before, we were discussing whether the mayor would make the appointment or the board would make the appointment. The Board of Health is not a municipal board, it's a state board. So we fall under different regulations than the municipal boards. And I know in the, it was pointed out that the law was actually shown to me that we are a state entity and we work under the, with the municipal.
Okay.
The
So,
the reason why it's a state entity is so politics are not involved in it.
okay.
That's the whole reason.
Okay, so if you do the interviews with the mayor present, then would he have the option to make a recommendation to you before you make a decision?
Sure.
Okay,
Yeah,
But, you
that
know,
works, I think, right?
recommendation. Go ahead, Bob, Rob.
Yeah, that sounds like that works, right? Like,
Yeah.
okay. Maybe I was just not understanding it, just, but that seems like if the mayor's involved in the interviews and we're all sort of discussing together, and then the mayor makes his recommendation and then we vote, yeah?
correct.
Makes the recommendation, and then we can decide whether we agree with the mayor's recommendation.
Is, not to go back on this, but is there a way we can just see the resume of the third person or the CV or whatever they have, just so I get like more of a frame of reference as to how we are here, or is that unfair to just look at that?
We can provide that third resume if you want it. That's not a problem.
Okay, that would be great for me. I don't know if you two want to see it, but
Michael can send that to you tomorrow. Michael
Thank
or I will send it tomorrow. Yep.
Okay. So we're meeting next Friday at 5:30, correct?
next Friday at 5:30.
Okay, and we're gonna have you're gonna send us the Zoom link. And we're gonna interview one candidate and then ask the other to leave the room. I don't know how we're gonna work that.
I
Okay,
think, Michael, you can make it so that they're each in a room and none of them can hear what the other is saying, correct?
All right, you can just let them in when you're ready. Yeah, you can do that.
Yep. Okay,
Well, I don't know with the open meeting law. That's the,
I think you can for that though, because it's a guest. You're not putting everyone else in it. I mean, it's still an open meeting, but that person would
who's being interviewed?
just be an interview. I mean, that person could also just log on to the public meeting if they wanted to, but I mean, I think
correct.
that's the way you
so
have.
we would do two separate Zoom links.
No, it's still one Zoom link. You're doing one Zoom, but then you'd have two, you'd be able to separate a person off into a room,
Breakout room.
breakout room.
All right, I'll look into
Yeah.
it. Because the
Yeah,
way we
and-
do it right now, we do it different. We use webinar instead of meeting, just so the
Okay.
public can't randomly start talking. But I'll look into it over the next week to see.
Take
what the-
a deep
Andy
dive into
Ford would
Zoom,
probably
Michael.
be going to talk to them.
Okay. So have we pretty much hashed this out?
I believe so.
Okay. And the only other thing on the menu is the next meeting, which, sticking with the third Thursday, would be St. Patrick's Day, the
Aren't
17th,
you, when are you going on vacation?
March
March what?
18th.
Okay, so the Thursday before your vacation.
Not an ideal situation, but I can live with it
Okay,
because I'll have been packed before then.
okay. Is that,
Okay. Are we
Okay.
good?
So is the 17th okay with everybody?
Yeah, it's fine.
yes, but don't expect me to wear green or anything.
What about your kilt?
Yeah, you won't see it. I'll just wear a coat. Okay. I promise.
Okay, so
Uh,
we'll see you next Friday.
All
All right,
right.
thank
motion
you.
to adjourn. Thanks.
Thanks, everyone.
Thanks, everyone.
Adjourn.